Welcome to Language Access is No Vitamin, an essential podcast for those shaping the future of healthcare in America. Let's transform our healthcare system from seeing language access as an optional vitamin to the cure of patient-centered care. Welcome to Language Access is No Vitamin. Empecemos. Hello. Welcome to another episode of Language Access is No Vitamin. My name is Joana Tudela, and I am your strategic partner for equal multilingual language patient-centered care. And today, I apologize, I'm having a little issues with my internet, but we're still here today to talk to you about the importance of language access. And today, we're going to discuss the hidden cost of language access. And I can go on and on for hours on this because there's so much that really is impacted by language access when it comes to healthcare that we don't normally think about. But I'm going to try to do my best. And first, we're going to talk about some of the things that are affected by language access that we may or may not think about it. And then at the end, I'm going to give you a few examples of how language access can really improve your organization when it comes to saving money, getting more clients, and just making better services for everybody that needs it, including your staff. So we'll talk about, the ROI when it comes to investing in language access. But first, let's talk about a little bit of the status quo, right? Like what is happening when it comes to language access? How does not providing quality translation and interpreting services, not having qualified bilingual staff that's trained and tested to ensure that they are able to provide services in their language that is not English in a level enough that, not only they can interact correctly with the patient, but also reduce the liability to your organization. And then also using interpreters that are not trained, using family members, using bilingual staff that's not tested, using kids, all of these things that continue to happen across the United States when it comes to providing services for those that not necessarily don't speak English, they just don't speak it very well or at a level that they feel comfortable having important conversations like healthcare related conversations in English. So they prefer doing it in their primary language. This is what we refer as limited English proficient individuals, not people that don't speak English, just not well enough to have these conversations. But let's talk a little bit about the status quo. What's happening? How does language access really affect your employees, your coworkers, your staff? I'm going to focus it a little bit on healthcare, but really you can bring this information into most fields, really. Let's talk about frustration and burnout, right? Healthcare staff members who frequently encounter language barriers might experience frustration and burnout. When they struggle to communicate effectively with patients, it can lead to emotional exhaustion and reduce job satisfaction. Not to mention when you add not only the language barrier, but a lot of technical difficulties or technology difficulties if you're using a phone or video interpretation, or if it's very hard for you to get an in-person interpreter when you need it, the waiting time that can also really affect the satisfaction of your staff, not to mention your patients. We're talking about increased workload. Staff members who are proficient in multiple languages might be asked to fill as interpreters, and many times without compensation and without training. And this really adds to their workload and potentially affects their job performance in their primary roles. We see this a lot of the times because it's hard to find an interpreter on time, or it's just, a little quick question that you have here or there. And we just think it's something simple. We might go to a coworker that we know speaks that language and we bring them in to, provide a quick interpretation for us. And what that really does is not only, you're adding more work to this coworker of yours, Many times they're not compensated by it, but they have to stop their duties, their tasks to go do interpretation. And then when they come back, it's not that those tasks are reduced, to make up for the extra work they did as interpreters, but is also continuous. So you really see a huge amount of overwork for bilingual individuals because they have to fulfill, whatever they were hired for. And in addition to do that, they have to, be the interpreters, which in its own, it's of course a job, right? This eventually affects retention rates and it creates a challenge for organizations. So health organizations' inability to provide adequate language services can make it challenging to retain talented staff. Healthcare professionals who are passionate about delivering quality care to all patients may become disillusioned if they see persistent language barriers hindering their ability to do so. Nobody gets into healthcare to be rich. We all get into healthcare because we want to help other individuals live their best life through health, or help them overcome disease or situations that it's making them hard for them to thrive and be their best version of themselves. So adding not only the language barrier, but adding all these other challenges, if you feel your organization is not providing you with the tools that you need to do your job correctly and to your personal satisfaction, it's very, very frustrating. And many times it definitely affects retention rates. And then, of course, having to replace those individuals, especially when we're talking about individuals that are bilingual and they're very proficient in multiple language, that is very, very hard. You're spending extra money that you could have just saved by retaining your staff. We all know, right, that retaining an employee, it's more cost efficient for any organization than having to go through a hiring process that includes marketing, HR work, hiring managers and other high level leadership, time on interviewing, and then packages. All of these things really, really that add up. So for all of organizations, we all know that retention is key, right? And language services, a quality language access really helps with retention. Um, and then let's talk a little bit more now from the perspective of the patient, because as you can see, there's a lot of things affecting not only your bilingual staff, but also those that are not bilingual and require the support of an interpreter to do their jobs. But patients are also very, very affected when it comes to poor language access. We're talking about communication delays. When healthcare staff encounter language barriers with patients, communication delays are common. Healthcare professionals might spend more time understanding patients' needs and conveying information, which can significantly slow down the workflow. On average, and I'm going to be giving you a lot of statistics, a lot of data, which is great that this is going to be recorded. You can pause, you can go back and write all these numbers. I invite you to grab a little pen and a notepad, because I'm going to be giving you a lot of awesome numbers that you can bring into your organization and explain why you need to improve your language services and your language access policies and plans. So let's go back to communication. So on average, healthcare professionals might spend an additional 15 to 30 minutes per patient encounter when language barriers exist. So if a physician, for example, earns $100 an hour, this could translate to an extra $25 to $50 per patient visit in terms of their life, of their time. So that can really, really add up quickly, because your providers are able to see less patients because they're taking longer. And it's not necessarily because of the interpretation per se, because obviously that will take more time. I'm sorry. It will take more time because you are adding a third person to the conversation. You're adding two languages, so you have to transfer. But when you do an interpretation session correctly, when your staff understands how the interpreter works, what they're supposed to do, what things are, what they're not, things can go much more smoothly, because then the interpreter only has to focus on the patient being able to do the job correctly, like understanding the first person, knowing how to speak and pause and things like that. So it's easier for the interpreter to really just, put their eye on making sure the patient is doing things right instead of having to manage in both the provider and the patient, in addition to the conversation and the interpretation of the messages. So, really, when your staff, your providers are knowledgeable and are skilled on working with interpreters correctly, that time, that 25, that 15 to 30 minutes extra that they are spending will be reduced to to a level not necessarily as a monolingual English visit, but very close and cost effective. We're also looking at extended patient visits. Lingual barriers can lead to longer patient visits, as healthcare providers and interpreters might need additional time to facilitate communication efficiently, like we just mentioned. This can result in fewer patients seen a day, right? So, language related extensions can result in seeing one or two fewer patients per day per provider. So, if a physician sees 20 patients a day, for example, and earns $100 an hour, this could result in a revenue loss of $500 to $1,000 per day, depending on how many physicians you see. So see how these numbers are starting to add up very, very quickly. And it's not just the providers. We're looking at admin staff. Staff might spend extra time on administrative tasks related to language access, such as arranging interpreting services or translating documents and finding them. And this can really add to the workload and reduce their efficiency in core clinical tasks. So a support staff might spend an extra 1, 2 hours sometimes per day on language access related admin tasks. With an hourly rate of ranging to $15 to $25 per hour, that can also add up very, very quickly in your numbers. And of course, with that comes a reduced patient flow. If you are having extended patient visits and your admin tasks are also being longer because of poor language access, now you're looking at seeing less and less patients. Just with the doctors, we were looking at $500 to $1,000 a day loss. So add also, your nurses, your medical assistants, your front desks, all of those reduce hours or reduce work because of language barriers that are not addressed correctly can really, really quickly add up. Let me see what other things we can do. Oh, I have another big, big number here I want to share with you. I have a list. It's a lot. So I'm trying to, simplify it and not give you too many numbers, but really provide you the quality information that you need to really become an advocate for language access in your organization. Let's talk about reduced billable hours. So physicians and other healthcare professionals might have fewer billable hours to, like I mentioned earlier, patient visits and communication challenge, and this directly impacts their income. The impact on billable hours depends on the number of affected healthcare professionals, their specialties, and the frequency of language barriers, of course. But for example, if a physician's billable hours are reduced just by 5% due to language access issues, and their annual income is $200,000, we're looking at a loss of $10K per year for this provider. So just by 5% of a decrease. As you can see, when it comes to language access, it really, really goes everywhere. It's not just about the interpreter. It's not just about the provider who is, directly working with the patient through the interpreter. It includes your admin staff. It includes your bilingual staff with job dissatisfaction, burnout, lack of recognition, in addition to, of course, the impact and the concerns with language access quality. Because if you're not training individuals, bilingual individuals that are proficient to becoming interpreters, and you're also not testing your bilingual staff to ensure that they have the proficiency level not only in the language but also in the medical terminology, you are creating a burning pot of liability that can bite you back very fast and without notice. And when we talk about liability, we're talking about big numbers. Even though health related lawsuits, when it comes to language related lawsuits in healthcare, only approximately 2.5% of them are related to language. So, language barriers related. It seems like a small number, of course, but when you look at what their cost, the average cost of a language related lawsuit for healthcare, it's $5 million. I'm going to say it again. It is $5 million for the organization. And this doesn't even include your legal fees, the PR work that your organization is going to have to do, to explain what happened, what are you going to do to not happen, all of these things that you have to do, the lawyer fees for your providers, all these extra things. We're talking just about $5 million directly to the family of the patient affected. That is the average. And of course, it can go big, very, very big. One of the largest ones we know about is in the 80s for Willie Ramirez. I don't know if you've seen the story about Willie Ramirez, but 18-year-old boy, Cuban descent in Florida. He went to the doctor because he had food poisoning. They used a family member as an interpreter who mistaked, the word food poison with being drunk, because in Spanish they're very similar. And by the time the doctors realized that, it was too late for Willie, and he ended up being quadriplegic. And it wasn't just about the language issue, there was a lot of things happening around there. Of course, the main one being that they did not use a qualified interpreter. And, because of that, there was a miscommunication. But there's also other things happening. There was a lot of cultural bias at the time, because the provider, even though he was also a Hispanic provider, he really didn't question when he came in and saw the situation. They told him he was drunk. He really didn't question, because he just automatically assumed that, 18-year-old college kid, Cuban in the 80s, yes, of course, you're on drugs or alcohol, moving on. He's just, let's just wait for his alcohol levels to drop so that we can, take care of him. And of course, it wasn't that, it was food poisoning. And this all to say that Willie's family, they got $45 million in this lawsuit. So, it can go very big numbers, it can be very small numbers, but the point is that regardless of how much you're going to be paying if something happens, the point is that you, as an organization, as a leader in your organization, you want to prevent any type of liability for your organization. So please do make sure that you have a language access plan. And inside that plan, you have, a whole lot of SOPs, standard operation procedures, that we love in healthcare. You have to make sure that you have everything in there, from hiring bilingual individuals to testing them to who's going to be your interpreter. Now you need to have depending on the size of your organization, if you need a section 1557 coordinator, if you have a language access champion, like all of these little caveats that need to be in your language access plan to make sure that you are compliant. And even if you are compliant, that does not mean that you are not liable for other things. It's about being compliant, but also ensuring that you have the best quality of interpreters, either that be in-house or through an agency, in person, virtual, phone, video, whatever modality or mix of modalities that you want to use. You want to make sure that you have the best quality, and that you're also only allowing those bilingual individuals who are tested and who your organization has deemed as having a high proficiency in both languages, including medical terminology, to be speaking to your patients directly in the other language, not to interpret, just to speak directly and provide services. And with that, I was trying to have like a little pen here with me, but I'm going to have to leave that for the next episode due to technical difficulties. But I'm still going to go through this little workthrough I did a couple months back that I wanted to share with you. And this was really, for me, a way to really being able to put in simple words, the ROI of really investing in language access, because that's one of the main, questions I have. One of the main things that I get asked is like, well, we don't get reimbursed, right, properly, if at all, for language access. This is really in-house cost that we have to do. And in addition to the answer being like, yes, that is the law, sorry, you still have to do it. I want to provide, my clients, the people that I talk to, the knowledge and the understanding that is not just about absorbing a cost because you have to follow the law. It's about there are a return on your investment. And yes, you might not get directly reimbursed for having your interpreter or for paying for translations that you have to do. You might not get money directly from that, but as any other things, a lot of other things in healthcare, you get that money through other ways. So I want to share with you a couple of numbers that I put down explaining the ROI for language access. So I'm going to be reading over here. So let's start looking at the appointment length, right? I mentioned that a little bit ago. We already looked at how much you are not saving by not training your providers and working correctly with interpreters because of the length of these appointments are longer, right? We saw the numbers from the provider perspective. You can lose, $500 to $1,000 a day for a provider. You can lose one or two patients of not being able to see them because of the length. But let's look as an organization, a little bit bigger numbers. So when we look at the language, the appointment length. So with improved language access, the length of appointments for LEP patients can be reduced, all right? Potentially aligning more closely to the duration and the cost of appointments for English-speaking patients. So what this means is a potential reduction of approximately $665 per appointment. So that's how much you can reduce your appointments, even with accounting of the use of the interpreter. But by, making the process more efficient and having your staff knowing how to work with interpreters and having quality interpreters, we're looking at saving of $665 per appointment. So if you see 100 LEP patients, let's say in a week, to keep the numbers easy, we are looking at $66,500 saved by reducing the length of those appointments. So this is one example of why language access, when done properly, can be worth your investment in your organization. Let me look about missed appointment, because that's another big thing. When you don't have anybody to communicate and answer your questions as an LEP patient, you tend to not go. So we see that a lot. LEP patients tend to miss appointments a lot. They don't have very good treatment adherence. They're twice as likely as going back in, being readmitted at the hospital. So there's a lot of things, and all that really brews down to communication, because they're not really understanding what's happening, what the treatment is, what the next steps are. And even if they are understanding all of that, they are not asking questions, either because of cultural differences, or just because they feel intimidated by being in front of a provider, or they just simply don't want to bother anybody, or they just don't want to do the effort because it just takes longer and they don't want to, I get that a lot. We don't want to feel like we are being a burden to our providers. Nobody likes to do that, right? So when you start asking questions, I don't know if that happened to you before, but when you start asking questions and you start feeling that the person is getting a little frustrated with your questions and it's just kind of like, okay, I need to get going, you kind of want to stop. You don't want to be asking more questions. And that happens a lot to our LEP communities. So let's go back to missed appointments. When you provide quality language access, it's been shown that you can have a reduction of at least 20% in missed appointments. Okay, so let's go and look at those numbers. So assuming a 20% reduction in missed appointments due to improved communication through quality interpreters, and tested quality bilingual individuals. And then we're looking at each missed appointment having an opportunity cost of approximately $200 for the 60-minute appointment. This includes, the unused staff time and the delay in patient care. So reducing missed appointments can thus result in better utilization of the staff time and your resources. But looking at the numbers, at the money that, all care at the end, to pay our bills as organizations, 20 less missed appointments for every 100 LEP patients, which is the equivalence of the 20% reduction that we're discussing, it's approximately $4,000 not being charged, and instead being charged the appointment cost of $700, using the rate with quality interpreters. So if you stop having 20 missed appointments for every 100 LEP patients that you are looking, we are looking at making $10,000. So it will be $14,000 that you're making by charging the $200 for the appointment, plus the cost of the extra appointments of $700. So $14,000 made versus $14,000 not made, so lost, from the missed appointments. So this is a very, very large number, just by not missing an appointment. Because why they're not missing the appointment? Well, maybe you are, sending that text message reminder or that email in their proper language, in their preferred language, right? So they're able to remember. Or maybe they're getting that robocall reminding them about their appointment in their language and not in English. Those are just very simple things that you can do to improve that communication. And if the patient is able to, call and talk to somebody in their language, and ask their questions, and making sure that they are going with the appropriate, with prepare as they should. So if they're going to the lab and they're getting a cholesterol, they're making sure that they are not eating for the past, 12 hours. Or if they have to, do a colonoscopy and they have to do a series of procedures days before, they're doing it correctly. All of this information needs to come to them in English, not in English. Not in English. This needs to come to them in their preferred language. So if you do all of these things, you're going to start seeing a reduction of those missed appointments, and that significantly will make a change in your numbers in your organizations. Now I want to talk a little bit. I'm going to give you two more examples very quick, and I know it's a lot of information, but the thing, remember, is that you can rewatch this. You can also watch it on Spotify and YouTube. So make sure that you save it as your favorite, you share it, and then you can always come back and get these numbers. I'm going to be adding as well the links to where I got all this information, because I did not just make up all these numbers, of course. So I'm going to be, sharing with you all the resources of where I got this. But I want to talk about two more things. Let's look at readmission rates, which is very big for larger hospitals, which they get penalized for readmission rates. So let's look at how providing language access that is of quality will help you reduce those rates. Okay, so current readmission rates are 15 to 18.5%. But for LEPs, the readmission rates are approximately 20 to 24%. So that means, 15 to 18 versus 20 to 24. So it's a significant amount of more readmission rates that you're seeing with your LEPs. And this is why we need to work with our interpreters. Let's assume that we can reduce the readmission rate by 38% using quality language access. And this is not a high, crazy number. There are studies that shows that you can reduce readmission rates on LEPs by 38%, which is huge for all of you that know, what comes into these rates and the penalties that you get. But so we're going to reduce 38% of the readmission rates for the LEPs. And the readmission rate, we're going to assume that is $25,000 per readmission, which is pretty much the standard. nationwide. So you're spending $25,000 per readmission, and you're saving, you're going to be reducing the rates by 38%. So let's look at a simple number, and let's assume that, let's look at 50 LEPs admitted. So for every 50 LEP patients that you admit, I have here an aggressive number and a conservative number. I'm just going to give you the conservative number, just to keep it simple. So let's look at conservative numbers. For 10, so you're saving 10 LEP patients are readmitted for every 50 LEP patients. That's a 20% rate. So we're going for the lower rate of readmission. So for every 50 patients that are LEP, 10 of them are being readmitted. Okay. If we're looking at 25% reduction, which is lower than the 38% that I mentioned, so less than what the research shows. So we're saying out of those 10 patients that you are readmitting, you're going to be saving 3 of them, right, with quality language access. So that means that you're only readmitting now 7 of them. What does that mean? That means a $75,000 savings just on 3 patients that you are not readmitting anymore just by having an interpreter there. This is crazy, I know. Let's be a little more aggressive, right? Because the research is there to be more aggressive with the numbers. So we are going to be looking at the actual higher number of 24% rate. So for every 50 LEP patients that you are admitting, you are readmitting 12 of them. So 12 LEP patients are readmitted for every 50 patients, 50 LEP patients at a 24% rate of readmission. If we are going to be doing 38% reduction, as research shows you can do and you can get with quality language access, you are looking at 5 patients out of those 12. So out of, you're saving 5 patients to not be a readmit. So now you're only readmitting 7 out of the 50 patients instead of 12. And again, we're looking at $25,000 per readmission cost. So you are saving on just 5 patients $125,000. Yeah, $125,000. So I want you to think, if you work at an organization that has ERs, so you're admitting individuals, just think of the amount of individuals that you are seeing, how often you're seeing, every 50 LEP patients, right? Is this a weekly thing for your organization? Is this a monthly thing? It can be a yearly thing, because if it's a yearly thing that you're admitting 50 LEPs, but you are able to save $125,000, that is a big amount of money for a small organization. Even for a large organization, which I'm sure you're going to be seeing more than 50 LEPs admitted, a month. So this can really, really add up. So if you're looking at for every 100 LEP patients with a reduction rate of the 38%, you are saving $250,000 just by improving your language access. So this $250,000 only looking at readmission rates, this is basically the cost of an in-house interpreter, actually even 2 of them, right? So when my clients or prospective clients ask me, like, where do I get the money? Like, I don't get money. I don't get grants for this. Like, where can I get the money to, invest in language access, invest in a training, invest in, testing, getting a plan, all of this? Look at your internal numbers. Look at how much you can save, or your organization can save, by reducing readmission rates, by reducing waiting times or the length of the appointments, or even reducing the amount of missed appointments. So you can see other individuals that are coming in and they are, being billed correctly. I want to leave you one more, because I know there's a lot of numbers today. So my last one is the length of stay in hospital, because the length of stay in hospitals are longer on average by 1.5 days more for LEP. So this really can range between 0.7 to 4.3 days. But we're going to keep it simple. We're just going to say 1.5 days more. So LEPs are staying in hospitals almost 2 days more than English speaking individuals. And then the cost of each day, it's approximately $2,847. So almost $3,000 per extra day. And using interpreters, qualified interpreters, can reduce these stays by 1 day. So instead of having an LEP stay 1.5 days more than your English speaking patients and costing them $2,847 per day, you are going to be only having LEPs staying longer for half a day more if you are providing interpreters. So using the 1.5 days average and that the interpreter reduces the stay by 1 day on this example, then for every 10 LEP stays reduced, we're looking at $28,470. For every 50 LEP patients being reduced in stay, we're looking at $142,350. And for every 100 LEP patients that are staying in the hospital and that we're reducing the length of stay by a day with the qualified interpreters, we're looking at $284,700. So almost $285,000 that you and your organization are saving by reducing the length of stay of 100 LEP patients by 1 day just by providing qualified interpreters. So as you can see, there's numbers out there, large, good numbers out there. The thing is that we need to kind of put them together and easy to understand and swallow so we can bring them into our leadership and be like, listen, we need language access, especially nowadays, because I want you to stay tuned. The ACA section 1557 was recently updated. So there's a lot of good things coming for language access. But there's also a lot of things that your organization, any health organization, because more are covered now, need to be aware of. So I invite you to follow me on LinkedIn and stay tuned because I'm going to be publishing and explaining what all these changes mean. But really, what I want you to get out of this episode is this. I want you to understand the language access is not a vitamin. It's not a nice to have, okay? It's something that is not only required by the law. It's not something that is just the right thing to do. It really is also money saver for your organization. It saves you on staff burned out. It improves efficiency of your processes. It makes your staff happier when it works. You can retain employees if you are reducing these barriers and providing them continuing education, like providing them interpreting training or bilingual medical terminology so they can improve their skills. Like all of these things really add up. And it's not just about the number, it's about the human resources, it's about other type of resources, right? We're wasting tests because of language communications. We are having individuals staying longer and taking other people's space, beds that they can stay in. So all these caveats, all these things are really affecting you every day, but we really don't notice because we just assume it's part of the process, it's part of just, the healthcare world. But when you look at it and when you start looking at the differences within those patients for those things, I invite you to look. I invite you to look who's staying longer in your hospitals, who is missing the appointments, who is, doing their treatment as they're supposed to, who is seeing all these improvements. And unfortunately, the reality is that you're going to be seeing the disparities for your LEPs if you're not providing language access that is appropriate and legal. Just gonna put back the legal part in there because that's just the way it is. But like I said, I show you a lot of different ways, a lot of different numbers that you can bring into your organization and be like, wait a minute. This is how we can afford this. This is how we can get better interpreters. This is how we can hire in-house interpreters. This is how we can test our staff. This is how we can bring training and cultural competency. All these things. There is a way of doing it that is not just, well, we don't get compensated, but we can bill for interpreter. I want you to open up your brain, your mind, and really look at all these numbers that I share. And there's way more. So don't hesitate in contacting me. And we're more than happy to share this and other research that's being done out there, and continue this communication, of course. So this is it for today for the hidden cost of language access, probably part one, because there's so much going on that I'll have to do a second or third part later on. But before we leave, of course, you know what's coming. All right. So our myth of the day is language access requires a 10% of a population. So we get this a lot. One of the main reasons why language access is, mandated in health organizations is Title VI of the Civil Acts right. And until recently, I'm going to include myself in there for full disclosure. Until recently, the conversation was really about, well, what is, the gold standard? What is the appropriate, what are my numbers, like what am I required to do when it comes to language access? And until recently, a lot of us were saying, well, if you have 10% of a population, let's say a Spanish speaking population, or a Haiti or French Creole speaking population, or a Russian speaking population, so a 10% of any particular language group or cultural group, you are required to provide language access. However, that is not really what the law says. That is not the truth. The reality is that the law does not provide any specific number. And what this means is that if you have one person, one person walking into your organization, and you receive federal funds, so you are bound by Title VI of the Civil Rights Act and the ACA, you have to provide them language access. You have to do it. You can't just be like, oh, well, we never seen anybody that speaks Vietnamese. Sorry, we are out of luck. No, that's not gonna go. This is not gonna fly in court if you get sued. Okay, the language, the law is clear about not being clear. There is no a threshold that you have to hit to provide language access. It's not 5%. It's not 10%. It literally means nothing. Those percentages, one individual. And updated section 1557 of the ACA really also clarifies that. And one of the things that you'll see in a post coming up soon is that you have to provide translated documents, vital documents, and I'm going to post the list of what are those. Vital healthcare documents need to be translated to the top 15 languages in your state, not your community, not your county, your state. So I invite you to look at what are the 15 most spoken languages outside of English, of course, in your state. And you are required to have that list of vital documents, which is, I don't know, approximately like 15 documents, 15, 20 documents, translated in all 15 states. If you're not doing that, you're not compliant. Okay? So a lot of information shared here. I hope you enjoy this episode and you share with your friends. Again, we are live on LinkedIn twice a month, but you can also watch us on YouTube and on Spotify. And I just very happy when somebody tells me that they heard my episode, because I'm really just doing this to share the knowledge, to share the information, and especially to start the conversation. It is time that we get this conversation started, because we need to do better by all of our patients, but especially for those that have a language barrier, and also a vision impairment and hearing. It's a lot of things happening when we look at language access. But anyway, that's a conversation for our next episode. Again, my name is Joana Tudela, and I'm the founder of Culturizing Access and your strategic partner for multicultural patient-centered care. See you on the next episode.